There's no immediate issues that are shown up there with your health check, but I'm just wondering if there's a way that we can help you manage things better in the future.
Okay, what would you suggest?
Well, have you done any tracking? You know, tracking of your diet, drink, mood, how much exercise?
Well, yeah, it's funny you should say that. I've got a tracker that kind of tracks my steps. And my children, they recently got me this mood app, which I haven't used it lots lately, but it kind of tracks kind of how you're feeling, and then you can kind of, you know, do things to change the outcome. And also this booze, this other thing that kind of charts how much you're drinking and so on, but I find it really difficult to keep kind of track of all of everything, you know.
I think you're right. It takes a lot of time using lots of different applications and so forth. So the NHS App Store have got an app for smartphones which combines all of those things. So it'll save you a lot of time. And what it'll do, it will give you a more holistic and accurate view of your health now, and also how you can manage your health in the future.
Right. How would that be different from what I've already got though?
Well, what it is you along with the app, you get one of these little bracelet.
Okay, so like another
like
bracelet.
that. But it monitors all of your vital signs, so your heart rate, pulse, blood pressure, how much exercise you're doing. Okay. And then you need to input your diet, how much you're drinking,
right,
and any other activities, and upload that to the app.
Oh, okay.
But it'll give you a health score, and it'll show you where you're at now, and then it'll give you a health range, which is where you need to be to stay healthy.
Right, okay. So it just involves me putting in a lot of information.
I think you get into a routine of it, and it will give you prompts of when to do it. So it's rather than doing lots of separate things, you can upload all the information from the bracelet, and also just you're adding the extra bits. It'll punch out that health score for you.
All right, and what's the health score going to mean for you?
It means that you can actually look at what you might need to change to manage your health better.
Right, how's that going to help me though in, I don't know, just feeling better? Because as I said, I've not been feeling brilliant lately. Well, and I'll just be filling in information and just getting a score. I don't understand.
It will give you an idea of what works and what doesn't work.
Right.
It will help you manage your health, as I say, and how much exercise maybe you should be doing, how much you're drinking. It only works if you're accurate in your input, though, obviously. But it will help us as well if you actually share the information. It's up to you if you choose to share the information.
Share it with who?
Well, it would be with the NHS. So it will be adding to a general research that is happening across the UK.
Yeah, see, I'm not happy with everyone knowing all my information. I mean,
it's entirely up to you how much you share, but if you do share your personal details, you get a couple of other added benefits, which is you would definitely guarantees you a place for you and your family here at the health centre. And also if you did need to go to A&E for any reason, it gets you priority, front of the queue.
I don't know.
Yeah, so that's basically it. You like put the information in and then it's all there. Kind of shows you the score and...
Well, it sounds like a good idea if it's going to be a benefit.
I don't know, do you know? I mean, first of all, I've got to put all that information in. That's time consuming. And then I don't know about sharing all that information. What, I mean...
Oh yeah, but the security is so good now, especially with the NHS. Any big organisation like the NHS, they've got really good security, haven't they? And they know half of this stuff in your medical records anyway. It's probably nothing new to them.
Yeah, but at least, you know, at the moment, someone would really have to dig to get all that information. And this is like literally laying out on a plate for anyone who wants to hack into this system.
Who'd want to hack into that? But it's all your health things. So the benefits are, what are the benefits?
Well, they were saying that we'd end up at the front of the queue if we were at hospital, which I'm a bit concerned about that because I think we're queue jumping, which is not
really.
good.
If you're helping them with their research and stuff, I mean, I think it's only fair.
I don't know. And then, in theory, once you get this score, it then, like the next day, you have to like either change your habits or whatever. I mean, I don't know.
Yeah, but you've been on about what you eat and things like that, so it's quite nice to have a reminder there for a bit of support and get some, some fresh ideas and things,
You think?
Yeah, I think it's probably worth a go, Especially if it's going to help with work and things. You've been working so hard lately, it'd be good to sort of know how it's affecting your health.
Yeah. Then I've got to wear that. Am I going to remember to wear that every day?
Yeah, it's nice. That's quite nice. And red suits you, doesn't it?
Do you think?
Yeah.
It's better than the other colours they had. I don't know.
No. Oh, come on, Aisha. I'm done. Oh, for goodness sake.
Oh, jeez.
What you got there, Aisha? Just got one of those new future health app things.
How are you finding it?
Yeah, no, it is really good actually. So you can connect it to your wristband, and it tracks like your heart rate and your blood sugar and stuff. But then you also put in like your food and your weight every day, and you get this score, and you can share it with your friends and stuff and have competitions and things. I think it's great. It really helps me.
Not sure I'd want to do all that.
Why not?
No, I just wouldn't trust having all my information out there.
Oh, but you can trust it. I mean, Mum's got it, haven't you?
Yeah, she convinced me, and I use it now to manage all my health and everything. It's good, but all that sort of private stuff, you don't have to share it. So when I input stuff about what I'm eating and when, etc., that's just between me and my app. No one else gets it.
What's the point if you're not sharing it?
Oh, there's loads of benefits to it though. I mean, like, do you remember when Phil broke his arm? Like, we went to A&E, we got straight to the top of the queue. I didn't have to wait just because I had the app on my phone.
I still think that's a bit freaky, the fact that they can put you to the front of the queue just because you've got an app.
Yeah, but if you think about it, if you're serious about your health and something happens, why shouldn't you?
Yeah, well, I just think it just means we're going to have longer queues in the NHS. It's not good.
Well, I love it. It works for me.
Are you still here, Eva?
Yeah, I'm just finishing some stuff up. I won't be long, don't worry.
All right, well, don't work too hard.
Okay,
Take care. See you later.
Time for an update.
She okay?
Mr. Sergeant?
Yeah.
Okay, yeah. Your daughter, like, there's no need to worry.
Right.
She's fine.
Okay.
But when your wife comes in, just make sure that she has to go and see the administrator.
See the administrator. Oh, hi, you're here. Look, she's going to be fine, okay? I've just spoken to the nurse, all right? They're processing her now. But the administrator wants to have a quick word with you first, just through there.
Oh, great. Okay, well, I'll see you in a
Yeah,
bit.
I'll see you in a bit. I'll wait here.
So just talk me through this. So this is what... Oh, do you want to get that for me? Thank you. Oh, hello, Mrs. Sargent. Do come in. Do take a seat. Thank you, Michael. I'll take it from here. Michael's updated me, and your daughter is comfortable. We're going to get her through A&E. He's going to be with her. But I did just need a quick word with you about the Future Health App data. We haven't seen any information from you for the last week. We haven't got any updates. Have you been updating regularly? Can I just get an idea what's happening?
It's been a really busy week this week, and you know, updating the app can take a bit of time. So I've missed it. I thought it was only a couple of sessions.
No, it's actually it is a week's data that we're missing.
Right. As I said, I've been super busy and not been able to fill it in. Obviously, that's not going to affect Samina, is it, today?
Well, it won't affect her in that she will be put into A&E, obviously, but we can't fast track her.
Oh, but the whole point of my being within the app is supposed to be that she gets fast tracked.
Yes, but to be in the app, we need to have the data. And if we're not getting the data, then we can't do what we're supposed to be doing.
I've just missed a couple of sessions.
Well, no, it isn't a couple of sessions, I'm afraid. It is actually a week's data. So obviously, your daughter will be seen through A&E, but we can't fast track her. So in effect, we are going to have to start from scratch.
That's so unfair. Can I at least start from scratch now?
No, I'm afraid not. I'm sorry. We've got so many other cases that we're having to deal with. We will have to make you a separate appointment to get you back in to do that.
That's so ridiculous. Can't you just do something about it now?
No, I'm sorry, we can't. I mean, the main priority...
What was the point of my joining the whole thing?
Well, obviously, if you're joining it, we need to have the data. But if we're not having the data, then we can't do what we're being expected to do, and we can't get your daughter through.
It's been really busy. It's been really difficult to keep on top of all the information that I need to put in. That's been
okay, but you were aware of the terms and conditions when you signed up that we did need to have accurate and complete data.
Can't you at least take into account the fact that I did fill it in for at least like more than a week?
No, I'm afraid we can't at the moment. I mean, this is one of the things that we do stipulate, that the data has to be complete and it has to be accurate. I'm awfully sorry. I mean, I know that your daughter is going to be the priority. She will be seen in the afternoon.
Can I just start again now? Can we just like fill in?
No,
I can give
I'm
you all the
sorry we
information
can't. I'm really sorry. We are so busy. Rest assured, we will see your daughter, but in effect, we are going to have to put you back into the programme and start again with those baseline measurements. And that will have to be taken another appointment.
Right, okay, well, I've got no choice then, have I?
Not really, I'm afraid, no. But maybe going forward, we know that there is going to be an issue with the data capture, and we'll have to work with you to make sure we do get that. But we need your data to be complete and accurate.